So, I will just report about the place of facial transplantation, the treatment of a great disfigurement. We have the chance, we have the 26th of November,
yes.
Day for day, it was exactly 9 years ago. Wow. Oh, it's a hazard, maybe. Okay, we start exactly at 4 o'clock afternoon. We start with the first facial transplantation 9 years ago.
So this is your baby?
It's my baby. It's our baby, yes.
Your baby. He makes a baby.
So, and after some times of preparation, we have the chance to perform this first transplantation with the help of many other colleagues. For plastic surgeon, Professor Langelet, Sylvie Testelin, yes, sure, and with Professor Dubernard. And Professor Dubernard is important because it was the first surgeon to perform the first hand transplantation in 1998, and the first both hand transplantation. And the transplantation of skin tissue had a very bad reputation, and with a hand transplantation very quickly was open the door for facial transplantation. So, today, it's 2014, and 1 century ago, it was the First World War. And I am living in the north of France, not far from the big battle in 1916, with so many Englanders coming from England in France during this First World War. And maybe you remember the destroyed faces of this soldier during the First World War. And maybe we can imagine the disfigurement of this soldier and the imagination of the surgeon coming from the world, coming from the New Zealand, Sir Howard Gillis, and a lot of surgeons imagine the new technique to restore the face destroyed during this war. And maybe we can make the comparison between the disfigurement 1 century ago and the disfigurement of our patient today is quite exactly the same, but the technique, thanks to the involvement in research, evolved, and today we have other possibility with auto-transplantation and allo-transplantation to restore a good face. In our department, for a long time, we were involved in microsurgical reconstruction, the suture of very, very small vessels in order to repair with living tissue the defect of the face. And some years ago, it was in 1999, a colleague asked me for this young patient. This young patient had the lower lip totally destroyed after dog bite, and what we can do to restore shape and function for this young patient. And we imagine a new auto-transplantation, a prefabricated face, like your prefabricated face with a scapula. And we imagine to use a muscle, the gracilis muscle. We prepared 3 weeks ago this muscle, and we transplant this muscle in order to repair the lower lip. You can see the operation, but after some time we have a big retraction of the tissue, and we can imagine today how it was difficult to obtain a good growth of the mandible. So result quite was better, but no perfect. So we report this observation. At the beginning of the 21st century, a lot of teams in the world was working about the possibility of transplantation in United States, in London, and in France. And for example, our colleague in Cleveland, Maria Siemionov, performed a lot of transplantation in the rats, but not for the people. And it was difficult to translate. And in France, in 1938, our philosopher Paul Valéry said, so the idea is nothing, and finally cost nothing, And he said, just to do it is much more important. Okay, do it, just to do it. In France, in 2002, we asked for the possibility to perform, and the law are quite rigid, and there is a lot of several agencies who gave an opinion what we can do, what we have not the possibility to do. And the consultative committee for ethics say we don't agree with the facial transplantation. No, we don't agree because we cannot imagine the future after this operation. And they said, but maybe it could be possible just for the reparation of this triangle, nose, upper and lower lip, and chin. And when we receive our patient some years ago, we had exactly the same defect. You can see the patient before, after retraction of the tissue, with this defect of the medial part because we didn't have the possibility to restore the function and the shape of both upper and lower lip before, after. Between 2005 and 2014 in the world was performed 31 facial transplantation. You can see here the different country, and we have the chance to perform 3 of this transplantation. And you can see here the list of this transplantation and the place where was performed this transplantation. And we'd like just to report very quickly our case with these 3 pictures parallelly reported. The patient in 2005, this young patient after ballistic trauma in 2009, and this last lady in 2012 with a big tumor, malformative arteriovenous malformation of the face. The picture of this patient just after the dog bite, some months after the ballistic trauma with amputation of the mandible, and this lady, I operated this lady some years before with a recurrence of her tumor. And you can see the different shape of this transplantation. On the left side, just skin, mucus, and muscle and fat. For the second patient, in the middle, with a part of the mandible. And for the third patient, skin, muscle, so and so, and maxillary, mandible, and the totality of the tongue. And you can see the result later. So, the most difficult problem for facial transplantation is the organization, because we have to divide the team in 2 parts. A part to dissect and raise the transplant, and the second for the patient to prepare the recipient site. Okay, so, and you can see near the donor the shape of the piece of skin, but this first for the first transplantation, the second with the mandible, and the third. And in our technique, we use a second free flap in order to survey and to make biopsy after the transplantation in order to survey the possibility of resection. This sentinel flap is the Chinese flap, a free flap, a classical free flap. The second team prepared the recipient site, and it was necessary like during the First World War. I read what Sir Gillis said. Okay, we have to wait for the retraction of the tissue and after to remove the scar. And exactly the same. But we have to dissect every vessel, every nerve, in order to restore not only the shape. The transplantation is not to restore a mask, is to try to restore a face with sensitivity, with movement, is the goal of this transplantation. And this dissection, this preparation, is quite difficult with a larger defect. So, and the second time is the most important point, is the delay when we cut the vessel of the transplant and we restore the vascularization. We use the term the ischemic time. And the ischemic time is true for every transplantation, must be less than 6 hours. And when, for the first transplantation it was the case, the donor is in the city and the patient in another place, we have to go very quickly. So it's a problem of organization. And you can see on this picture this big moment, this important moment when we release the clamp, okay, and when the vessels are sutured and the blood flow come again in the transplant with a modification of the color of the skin of the transplant, the modification of the consistency, the volume, this piece of skin, bone, she was died without life, recover this life thanks the revascularization. And after this most important point with microsurgery, we have to restore every place from the deep until the surface, the sutures, the mucus, the place, the bone, to synthesis the bone, to suture the nerve, every nerve, and from the deep until the surface. And you can see here the lot of people, almost 50 people involved in this transplantation, and you can see the result at the end of the operation. The first patient, the second patient, and the third patient with this view from open. So, and sometimes later, the first patient, the second patient, and maybe we can do some criticism with the second patient because the color of the piece is not exactly the same as the color of the patient. But we have to study the shape in order to obtain the best aesthetic result. But aesthetic result is the first step. The second step is a functional result of this transplantation. So we use, like for every transplantation, heart, lung transplantation, or liver or kidney transplantation, we use immunosuppressive treatment because the risk of resection are very, very high. Every patient develops, after some week, a first episode of resection, and we try to find the good level of the drugs in order to avoid the chronic resection. The initial immunosuppression, and you can see we diminish little by little the drugs, the level of the drugs. And in our protocol, and it is interesting because we speak just before about stem cells, okay? And we use stem cells from the donor in order to try to improve the tolerance and to induce maybe some quite chimerism. So, it's the paper. And now some picture of the other transplantation. Our first, the second transplantation in China, okay, but the patient died after two years. The first transplantation in Paris in 2007 for von Recklinghausen disease, and the first American transplantation in Cleveland by the team. And other patient, the before, after, with the big disfigurement, some blind patient, and the first patient with burn, unfortunately, he died 3 weeks after the transplantation. It's quite, the facial transplantation is quite a big problem. The tolerance and the risk of infection and the risk of died. Okay, the transplantation in United States, before and after. And the question of this third transplantation in Boston with this patient after electric burn. And you can see on the right side open the patient before. After the first reconstruction with the free flap and 1 month after the transplantation with this ethical question. Is it necessary to perform facial transplantation for a blind patient? Okay? But maybe it's necessary. We have a very interesting discussion with our colleague from Boston. Because the goal of facial transplantation, like the goal of every reconstructive facial surgery, is to restore shape, but restore the function, and to permit to the patient to have a quality of life. The word was used a lot this morning, the quality of life, the integration in the society. And you can see here, it was 1 year after the transplantation in Brussels with Professor Dubernard. She was in a restaurant. Nobody recognized this patient. They don't recognize that she was transplanted. So, the goal is to restore the function, but in order to restore the function, we have to, after the transplantation, to help this patient with a big re-education. You can see this patient doing a lot of exercise. This lady was reconstructed with the totality of the tongue, and 6 months after the operation, she had the possibility to eat quite normally, okay, and she speak. The mobility of the tongue is not perfect, and she has to be improved, but the result is fantastic for this patient.
Un gâteau à la crème. J'ai perdu ma bicyclette.
We continue. So, just in order to precise the indication, in 9 years, just 31 transplantation through the world. The indications are very rare. And personally, I don't totally agree with some indication in some country. Okay, we have to discuss. It's a big challenge for the surgical team or for the patient, and the risks are very high. Firstly, according to the pathology, the traumatic patients, either burn patient or ballistic trauma, with around 30 years after ballistic trauma and other trauma. And but if for ballistic trauma, the question must be raised either at the beginning or after. In such case, we use classical technique, but we use classical technique after, and it was a question just before, after maybe 20 operations, okay, and 2 years of treatment. And maybe with a transplantation, we can, in one step, just restore the face of this patient. For the burn patient, it was a problem with this young lady. So in order to restore totality of the face, there is a lot of technical question, what we have to do with the muscle of the face. And the problem was for this lady to find the donor who has the possibility to restore the face of this patient before. Okay, so, and is in such case, for psychological reasons, we don't accept to perform the transplantation. Patient developing malformation of the face, and for facial malformation, the problem is when we have to operate. And next week I have to speak about the face transplant for the children. Is it possible to imagine the facial transplantation for the children? Okay, and maybe for some tumor for the young patient on some vascular malformation, like both case, this young patient with von Recklinghausen disease, and or these other young patients with venous malformations. In other case, we avoid, for this patient with von Recklinghausen disease, we don't accept to perform, for psychological reasons, to facial transplantation. For arteriovenous malformations, okay, it's a big problem because this malformation, arteriovenous, can be vascularized not only by the external carotid system, but together by the internal carotid system. And if we perform transplantation, maybe we have a recidive of this disease into the transplant some months or some years later. And the indications are very, very difficult. So, except for our third patient. This third patient I operated in 2003, firstly, okay? So, for this arteriovenous, she had a very, very often hemorrhagia, okay? And the vital prognostic was worse for this patient. And after some months, firstly, we put just a latissimus dorsi free flap. And after some years, we have a redux of recidive of this malformation, and you can see into the free flap the arteriovenous, and with a lot of bleeding every week or every month. It's why we decided to propose a most larger amputation of the face and the restoration, and you can see the patient sometimes later, okay, with quite very interesting morphologic and functional result. So, the problem of malignant tumor. There is a lot of poster speaking about oral cancer and malignant tumor. But for malignant tumor, we think due to the risk or development of new tumor according with the immunosuppressive treatment, we think we have not to use facial transplantation. One example in Spain, and the patient died sometimes later. So maybe, yes, in the literature was reported in two cases. Firstly in China, second time in Austria, a transplantation, a part not of the face, the ear, the first case after resection for a melanoma, is a cancer, and the second case in Austria for carcinoma of the tongue, they tried to do, and the patient died less than 1 year later, and in our opinion, is a contraindication of facial transplantation. So, but the question is raised for larynx transplantation. And for us, for example, we received this patient some months ago. She was operated for carcinoma of the floor of the thymus 15 years before, without it's a specific cancer for the lady, without virus, but without tobacco. So, and the problem, she was operated with irradiation. She developed X-ray necrosis, and today, like that, she cannot eat through the mouth. Okay, and she has a lot of difficulty in order to speak, and we have the development of infection and retraction of the tissue. And for us, the question is 15 years without cancer. We don't have any other possibility to improve the face of this patient. Maybe, it could be, maybe, we have to discuss, and you can imagine what we can obtain after one operation. But behind, there is a vital risk with immunosuppressive treatment for this patient. So, the limit of facial transplantation. The limit are for the baby, the minimal age, and if we can find a donor for a baby. Yes, for example, we received some years ago this young patient with a congenital nevus of the face, okay, with involvement of the bone in the deep. And for this patient, we think facial transplantation or not. and we don't agree, and we use classical technique. And maybe, we don't have any image. It's a pity because, 20 minutes, okay. So, second, maybe in the future when this patient is adult. So, the problem of blind patient, if we have, and before we thought, no, why facial transplantation? And for example, we receive this patient after shotgun trauma with epitasis for the nose. He is blind. He received more than 30 operations, okay, during 8 years. But I cannot accept today that we do a facial transplantation for the failure of the classical technique. Either we start at the beginning or we use just classical technique. The limit is for this patient, you saw, because this limit, shotgun trauma, more than 30 surgical times. And Italian people, 30 years before. And he reconstruct his life normally, so, but with bad quality. But can we imagine 30 years later to use a new technique to restore a face? I am not sure. So, the problem of the psychological aspect in order to choose the good patient and the reception. Very often, the people ask us about how to imagine we can accept the part of the face of other people. But what is interesting is the patient, the first lady, Isabel, when she said, without face, we are nothing. Okay? You give me again an identity. And you can see here, the problem at the end is to find the donor. For the first patient, we were waiting more than 2 months. For the second patient, more than 7 months. Okay? And it's a problem of the donor. In France, we have the duty to restore the face of the donor in order to present the donor to the family. And during the operation, we have to print the face of the donor and to create a mask, because the dead patient have no visage and no face, as a mask, okay, and to restore the mask of the donor. And you can see here on the pictures the quality of the restoration. Okay. And the future, maybe, and it is interesting because just before we received some information about new technology and the involvement in research and in the usage of stem cells and the creation of the new tissue, maybe in the future, okay, there is no transplantation anymore. And it's why it's totally necessary for everybody to be involved in a research program in order to create tomorrow or later new tissue, and why not new organ to restore a piece of the face. The future of the transplantation is like your initiative to be involved in a research program, and it's why, like you, we create in France our proper institute, the Facing Faces Institute, in order to try to develop this new technology. So, I would like to thank you for your kind intention with this. Okay, the question of the donor, and we would like to make some homage to the donor it's no possibility to perform transplantation if nobody accepts to give a part of her face. Thank you.